Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us again. This evening, we're going to be having a conversation with Dr. Huy Dang. He's joining us here to talk about the condition of uncontrolled gout and how he treats his patients. Welcome to Health Professional Radio, Dr. Dang.
Thank you very much, Neil. Appreciate you having me on.
Thanks for taking the time. Give our listeners a bit of your background. I understand that you're living with gout. Tell us your story.
I was more recently diagnosed with gout, but I've had gout for probably approximately 23 years. Mm-hmm. Had the symptoms since I was probably about 20, so it was a little unusual for someone my age to have gout. When I first had my first attack, it was misdiagnosed as a fracture because I was relatively involved in a lot of sports, and I'd get injuries here and there. And at that time, I was in medical school, and I was going through a surgical rotation, and I couldn't remember quite how I had injured this joint, but when I went to the physician, they're like, oh, it looks like the joint's pretty swollen. I took an x-ray, and I had an old fracture of a tibial sesamoid. And I was like, oh, it's probably the tibial sesamoid that's fractured and that's hurting. You know, at the time, it was like, well, we can prescribe some time off, but I didn't really have time to take off because I was in the middle of a rotation. Mm-hmm. So I just kind of lived with it and rolled with it and put on a fracture boot and just kept on going and took some anti-inflammatories. And it hurt for a good probably solid 3 or 4 weeks. And eventually it died down. And probably several months later, I got another attack. And for years, probably the next 4 or 5 years, it just was diagnosed as the same thing. Mm-hmm. At one point, I started realizing, like, this doesn't quite seem right, even though I had this injury in the past. This recurrence multiple times in this joint doesn't quite make sense, and the amount of inflammation doesn't quite make sense. So my thought process is that it has to be a more systemic issue that's going on. Mm-hmm. And which, surprisingly enough, since I deal with gout so much, one day I just went, well, maybe it's gout. My lab values at the time were relatively normal. I was in the normal range of uric acid. And most people had just basically dismissed it as possible gout because, one, it's my age, and two, my uric acid was normal. So I actually ended up just taking a joint aspiration myself, and lo and behold, it's uric acid crystals are in there. That causing this repetitive flare. So that really kind of changed how I kind of looked at it, because the more things I looked at patients that just quite didn't meet the specifications of whatever injury or diagnosis they had before, mm-hmm. we started seeing gout much, much more in patients and being able to diagnose it more, and not just going by labs, but going really by our clinical suspicion, and sometimes confirmed with actual joint aspirations or an aspiration of the joint in order to fully confirm gout. And I think that's really quite changed how we look at things, because gout's kind of one of those deceiving things that doesn't always present as this one big red swollen joint. I've seen where it's been kind of subclinical for years and years and years, and people just attribute it to arthritis or attribute it to just getting older or little small ligamentous injuries, and it's been gout all along. And the problem with having gout that's uncontrolled over that long of a period of time is it's building up not just in that joint, but in multiple joints, multiple systems, multiple organ systems, and it can wreak havoc quite a bit. And that's kind of part of the things that I later figured out that can fully affect it, because even when I ended up getting gout, mm-hmm. or actually understanding that it was gout, I was treating gout basically on the flare-ups, right? I would take the allopurinol, thinking that I'm low enough because I'm still within the normal range, and that I would be perfectly fine if I just treated the inflammatory things. I would live basically in between. My life would exist between inflammatory processes. And as it progressed, I was getting like a gout attack once a month or once every 3 to 6 weeks. And relatively getting out of control, but I assume that's just what we're going to have to do. And what really kind of changed things around was I was actually getting an exam for disability. Mm-hmm. And it was for disability insurance. And what ended up happening for disability insurance, they drew some blood. And when they looked at my blood, they were like, my liver function was out of control and my kidney function was elevated. And the question that was asked to me was, and your transaminase my transaminase was also kind of off the charts. And they basically associated with me drinking, and I don't drink. So, as I looked further into it, I'm like, okay, there's something definitely not quite kosher here. I'm not quite sure what's going on and why all my lab values are off. And it's actually very fortuitous. I actually went through this process of getting the disability insurance because at that time, I was also having a lot of gout attacks. And I ended up getting IV infusions to actually help reduce my uric acid burdens because I was getting a lot of uric acid crystal buildup to the point where they're in my hands and in my joints, and it was more and more difficult to move. And I was thinking that I was going to be separating myself from my surgical career of reconstructing foot and ankle. Mm-hmm. And I thought, well, I'll give this IV infusion kind of a last chance to see if it can reduce my uric acid burden. And what I found out is that it actually resolved a lot of my uric acid burden. And I was able to finally mobilize my hands and my feet, and it wasn't all the aches and pains I've been having over the past, I'd probably say 10, 15 years. A lot of it dissipated, and I started realizing that the reality is a lot of my back pain was uric acid. And the other thing that I also found out was as I was taking more labs to figure out whether there was a bigger issue going on with my liver and kidneys, after doing the IV infusions, and reducing that uric acid burden, reducing the load down to basically zero, and clearing out all these crystals in my body, all my labs went back to normal. So it really fully reinforced the ideology that gout is not a singular joint or singular systemic problem. It is a whole body systemic problem, and every organ system can be affected other than the brain.
As far as how it's changed the way that you treat your patients, that's pretty much a no-brainer. But how often do you get an opportunity to change the mindset and the thinking of fellow physicians who've been diagnosing this or attributing it to something different for years and years? How do you get through to the medical community about the severity of uncontrolled gout and about the importance of diagnosing it properly and early?
Unfortunately, it's almost a person-by-person basis. Until we drive this into a bigger understanding so that we can have actual lectures that really go to more primary care physicians who are going to be one of the first people to see this, it's on a person-to-person basis of talking to the patient and then talking to their doctors, and then we have kind of a long conversation of hey, this patient's having this many systemic issues. I think it's stemming from the uric acid buildup. Let's try something to try to reduce this and see if we can decrease the burden and all the other systemic problems as well. They start seeing that, a lot of the symptoms, a lot of these other symptoms that people are having also start dissipating, and not just the gout, the one gout drug they think they were having. It's like pain from everywhere else, or different lab values, or lowering other systemic problems that they've been having for years and not really realizing that it was an offshoot of gout. And so, when I explain it to other doctors, sometimes I equate it to diabetes, mm-hmm. right? Because for years for diabetes, our main thought process, we just gotta control the blood sugar. And that's the only thing we have to worry about. And as long as we keep it down this certain number, we're fine. But as the years have progressed, we started to realize that, diabetes affects your eyes, it affects your kidneys, it affects your nerves. And the more we control it proactively, the less systemic problems we have. We don't treat diabetes anymore with just a singular thought process. We put diabetics on, kidney protective medications. And we, make sure that we get eye exams and we do everything else. So I think we have to look at gout the same way because it affects so many systems that we have to proactively think, how do we not just reduce the flare-ups and the current inflammatory process, but how do we do this long-term wise so they don't destroy other systems?
Well, Doctor, where can our listeners get some more information about uncontrolled gout? I mean, about 4% of American adults have gout. And I believe we can also visit the Evolution of Gout website at www.evolutionofgout.com.
Thank you, Neil. I do appreciate you having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.